Oh, right now we're going to turn to the town of Tonawanda, where the proverbial help wanted sign is now up. The town looking to hire nearly 24 first responders, mostly EMTs, as it is creating its own ambulance service. This was announced a couple of months back. For decades, the town has had its own paramedics who respond to health emergencies, but now the town is also buying its own ambulances and will actually take care of the transportation for those patients. Earlier today, I talked about all of this with Matthew D. Rose, paramedics supervisor for the town of Tonawanda. Thanks for taking time to talk with us. Let me start by kind of backing up. Why is it that the town of Tonawanda is making this pretty substantial move when it comes to emergency services there?
Well, we've had a paramedic service for the past 50 years now, and we felt that this was the next natural progression to enhance our public safety offering by starting our own ambulance.
Tell our viewers what the difference is between what you had before and what will change come early next year.
Sure. So currently we have the Town of Tonawanda paramedics, and we use a commercial service provider. We're going to have our own. We're still going to have the Town of Tonawanda paramedics, but we're also going to have our own ambulances now. It allows us to build some really good career paths for individuals that are looking to become career EMTs and career paramedics.
You've made it now to this point where you're beginning the hiring process. Who is the right person for one of these positions?
So somebody that's looking to make a long-term career, somebody who's looking for a good solution for themselves to be a professional, hardworking, dedicated and driven individual. We're looking for people that are self-starters, people that are initiators and they want to improve and be high-quality patient care providers.
And there are good benefits that go along with these positions.
Yes. Yep. There's a state pension at the end, health insurance, vacation time, sick time. We're trying to make a really nice work-life balance for folks. So the schedule that we're proposing to put forward would give everybody that's working on the ambulance every other weekend, a 3-day weekend, a Friday, Saturday, and Sunday off. And then you don't see that very much in our field because the hours are so demanding. We're trying to make a really good work-life balance for folks.
How many people total are you hiring?
So right now we're looking to hire 20 EMTs and potentially 2 additional paramedics. It makes us a little more efficient. So not every call requires a paramedic to take them to the hospital. By having the EMTs on the ambulance, it allows us to get that patient to the hospital with the appropriate level of care and still keep the paramedic available to answer other calls that are going on in the town at the same time.
How much of an investment is this from the town of Tonawanda?
It's a significant investment. I don't have the number in front of me right now, but it's a significant investment. But it'll at the end of the day, it'll provide a high quality of patients' care and public safety that is, everybody's biggest concern is making sure that we have the highest quality patient care and best public safety we can give.
How quickly do you think you'll get these ambulances, and when will this sort of all take effect? You have to hire these people first, right?
Yeah, we have to hire the people. So we're kind of in the civil service process right now. So people can apply now, and then the civil service has got to process the applications and generate a list for us. Then we'll have interviews and background checks and hire from there. To fill out an application, go to the Erie County Department of Personnel website, and they want to go under the continuous recruitment, and there they will see the emergency medical technician posting, and they will also see down towards the bottom the paramedic. It's called paramedic trainee. Everybody asks about the trainee. That was just what the posting was when it came out 49 years ago. That title hadn't really changed. So it's a little bit of tradition, if you will. But yeah, we just encourage people to go there, fill out the application. If they have questions, they can get me my email. So we purchased 4 ambulances. They are at the distributor right now. They're getting some safety upgrades that don't necessarily always come inside the ambulance, some safety netting, a better backup camera, and some other stuff, and then the stretchers and all that stuff being installed by them. So they're there now. The company that we use to purchase the ambulances saw the pandemic issues coming with the supply chain, and they actually ordered a ton. These ambulances, not by us, but by them, were ordered over 2 years ago. So they actually just started coming in, and they didn't have a home yet, so we were able to get them. I don't want to put a time frame on it, because every time I've tried to put a time frame on it, it's gotten a little bit, it's been not right, and I don't want to make an inappropriate assumption right now. But we're moving along very well in the process. There's some stuff that's taking a little bit extra time, but by the time we're ready to roll, we should be in a really good spot. So
still sort of early 2025 or maybe middle?
That is the goal. That is the goal right now. That timeline, I don't want to say it's a moving timeline, but it's definitely, we're kind of at the mercy of some outside source, civil service, supply, which has really kind of not been bad, but being able to get all those parts together. So
yeah.
We've made massive strides in the last couple of weeks. So we're working in the right direction for sure.
You heard him there mention the upfront financial investment that it will take to make this happen, but town leaders have said over the long term, this should lead to cost savings. The impetus for this, according to the town supervisor, was to improve response times with ambulances. The president of Twin City Ambulance, which has had the contract there for a long time, told 7 News back in October that there were no issues with response times in the town of Tonawanda or the other municipalities that it serves.
I can tell you there has not been a single call in the last 12 months that has gone anywhere near an hour. In fact, the longest response time we've had out of the last 10,000 plus calls has been 36 minutes. One call.
Well, the paramedics supervisor told me today that the town of Tonawanda will still partner with Twin City when there is high demand and there aren't enough town ambulances available.